Because it talks about all of this and above. So the Medicare Part C is what people hear on the commercials as Medicare Advantage. Okay.
Yeah.
It's Medicare Advantage. And to introduce this, we call it Medicare Part C, right? Private insurance companies is what's approved by Medicare. So Medicare has to approve the private insurance companies that provide, the services and things like that for Medicare Part C. And it most times covers everything in parts A and B. So a lot of people get scared. It's like, am I going to lose Medicare? Am I going to lose everything that I have currently? It's just an addition to. It's an addition to.
Yeah.
It's going to give you more in your bucket. Your
That's
bucket.
probably the most, that's the biggest question I get whenever I've been in the field is, does this take the place of my Medicare? Does it take over, or actually do I lose Medicare? And of course the answer is no, you don't lose Medicare. In fact, you have to have Medicare Parts A and B to get this. So just really quick, the history of this thing. Back in 2003, it was really momentous when Medicare Part D, which you guys covered last week, came in that covered prescriptions. That was huge news. But part of that, it also adopted these Medicare Choice or Medicare Advantage plans that have been out there privately, but now they were able to put the prescriptions, put everything in the Part C. They're run by private companies, insurance companies, but they are heavily regulated and they have to follow the protocol of the government to be approved. So you don't lose your Medicare Parts A and B. You get to keep it and you get to have all the benefits that you see on this wonderful chart.
Yes. Like I said, it's an addition to, you just add it onto your bucket, because C has to have the A and B to be one. It's like a puzzle piece. It has to be one.
Exactly.
Oftentimes it includes extra benefits. So, in part A and B, guys, we didn't speak about the vision, dental, hearing. We didn't speak about that. We kind of like tiptoed around it, but this is where part C kicks in, right, William?
Yes. And do you need more hearing coverage? Do you need more vision coverage? Do you need more dental coverage when you get older or when you're younger? In most cases,
Older.
When you're older. And unfortunately, Medicare Parts A and B do not cover that. And so this is where it's truly an advantage for many people to join Medicare Part C.
Yeah. And that's a good thing too. And a lot of people ask about another question too, William. What is that about prescriptions? Oftentimes Medicare Advantage plans include Part D coverage.
Yeah, and they do that many times at no additional cost. So it covers that. You don't get the penalty, and you get some help in covering your medication. And here's another thing about these Medicare Part C. Don't want to sound like we're pushing these, because they are not for everybody.
No.
Everyone has to make their own individual choice based upon their own individual circumstances. However, the advantage of these plans, the way they're designed, is to feel like the plans you've always had when you work for the company, or when your father worked for the government or the electric company, or whatever the case is. You go to the doctor, there's a copay. You go into the hospital, there's a copay or maybe some co-insurance. They have the similar feel of the insurance that you've always had. And that way it's not really complicated, that if you look at it that way.
Right. Or unfamiliar at all. So that's just a breakdown of it too, because it says like, well, what is it about? Like you said, something you've always had when you worked. Like I said, with the copays. Now, the only thing about it, I know William mentioned that it's not for everybody, and that is so true. Let me tell you why. Because you have to stay in network. You have to stay in network. Now, don't say we're not telling you can go out of town and get sick and go to the emergency room. No. But I'm just saying, just for the full benefit of it, you have to stay in network. So you have a network of doctors and a network of hospitals within the Medicare Advantage plan. So if you have an agent that's actually doing a plan review for you, they must ask you, who are your doctors, to make sure they're covering the plan that you want.
Exactly.
What hospitals do you go to? What prescription do you take? Because we want to make sure that you're covered fully within the plan that chooses that's best for you.
Exactly.
Well,